I'm Alice Omboi. I work with the County Government of Makueni. I am a Chief ICT Officer leading the component around innovation. I'm excited to be joining Insight Health Advisors today for what would consider a sharing aspect of what IHA has been able to support within the County Government of Makueni. One of the key things has been cross-learning, getting to understand what the Lake Region Economic Bloc is doing or has been doing. Are they able to identify priority areas? What is exciting is the fact that we have learned quite a bit when we've been going through the mountain model in matters scaling within the public sector, the components around innovation. As one who has been working behind the scenes, IHA has been an answered prayer for me, because we've tried to sensitize the departments to understanding the scale up of innovations, but that was a challenge. So when IHA came in, they supported in sensitizing, and especially the fact that the focus was within the health sector, and it made it very easy for us to engage together with the Department of Health in identifying, scanning, realizing the potential of what innovation can do, and up to this date just being able to share the success story around the innovation that we've been able to scale up within the county. Of course, with the support and the realization of what the top leadership is about, and being able to engage the communities in realizing the future is innovation. So I hope that within the Lake Region Economic Bloc, one of the key areas that they have to identify, because it's a unifying factor of different counties, they'll have to realize what is unique within these particular counties and how they can work together. So collaboration is key, and that is what we're doing here, because we're collaborating, we're learning. I'm also relearning what the needs of the region is about and what it is. So I hope that at the end of this particular session, and as they go through the mountain model, one of the key things we will realize is the implementation of workable solutions, and the fact that county governments are in a position to also consider a different way of adopting procurement processes. Thank you.
Maybe from the Kajiado point of view, you might answer some of those questions.
Thank you so much. My name is Osoro Benson. I work for Lake Region Economic Bloc Secretariat as a lead health peer. So we are here today because we are convening 14 counties within the Lake Region Economic Bloc, and we are having an engagement on issues to do with the public sector demand for health innovations. So we have convened the 14 members so that we engage on how, as a region, we want to come up with innovations which will help to address health issues within our reach. Actually, we are using the mountain model, which brings in involvement in all the stakeholders within the health sector. I hope you are aware that in the health sector, we have so many actors, we have many critical cadres who play a critical role in implementation of healthcare services. And in this, we thought it's okay we involve all of them when we form this cohort of implementation. For instance, we have the level ones within the healthcare system, that's the KEF levels. We have the level one, which is the community units, where we have the CHPs, and they are with us today. And we have level twos, which are dispensaries, level threes dispensaries, they are also represented here, as well the sub-county levels and the county levels, not leaving behind the management within the health sector. We have chief officers, and we have a minister from one of the counties within the region.
Annual newborn and health services around issues of radiography services in our health facilities.
My name is Bernard Njibu. I'm the project manager for Insight Health Advisors, and I must say today I'm happy and we are excited for the launch of the mountain model base camp meeting with the innovative cohort from the Lake region. So this is a journey that started 2 months ago, where we got interest from the region and also we signed an MOU to implement a project known as a public sector scaling of innovations through the mountain model. And today being the first day, so we're excited to introduce the concept and also get sufficient buy-in from the participants and also the county representatives. Yeah, so a bit of background. This is a continuation of work we've been doing in Kajiado and Makueni as part of phase 2, whereby we are looking to scale the concept in 14 counties as compared to initial where we started with 2 counties in Kajiado and Makueni. So the whole idea is to get economies of scale and also to target the region that has the greatest population with a wider challenges or wider group of challenges in health. And so we want to apply the scaling of innovations and to address the health challenges. And yeah, we look forward to better health outcomes. The project is a 24-month project, and what we are looking at the end of this period is to successfully scale 4 to 5 innovations in the public sector across the Lake Region Economic Bloc, which will help us address some of the health system challenges and health service delivery challenges that are currently in the region in an order of priority. Yeah, so through the next few weeks, we'll be starting a process called demand articulation, whereby we'll be identifying the key or the core areas where we have challenges and prioritizing them in terms of which one needs to be addressed immediately, followed by the rest. So yeah, that is the mountain model.
What is something interesting? Okay. I was excited the minute I got into Kisumu. The keyword Dala stood out for me. So I guess I'm in Kisumu Dala, even despite the fact that I don't know what Dala means, but I'm happy to be here. Yes, home. Yes, Kisumu Dala home.